Hi there, Rhiannon again from Not Just Backs. It's now about day 10 to day 14 since you first came for your first appointment. Hopefully by now you would have noticed definitely some change, be it maybe pain, be it range of movement. You can do more things at home. You may have a bit more energy with what you're doing. You might find tasks easier to do. You may be able to sleep better. Your headache pattern might have changed if you're coming in for headaches. So there's a whole variety of things that might have changed, or one of those things. And so we use a lot of discussion about your lifestyle and how you felt to show that you've changed, because lots of people come in and say, no, I haven't changed. And then you look at them and then they can bend and touch their toes where they could only go halfway before, and they're going, you definitely changed. You go, oh yeah, I didn't really realise that. So we can see things that probably you may not feel to start with as well. I also wanted to bring to your attention a way of reducing your osteopathic bill. For those of you who have a joint strain, a muscle strain that only takes 3 or 4 sessions to sort out, then this is not for you. However, for those people who have more longer term issues, we have certain packages that you can buy up front, and that gives you a course of treatment, and it makes your treatment price severely reduced, put it that way. So, for example, if you have a disc, sciatica, a spinal curve that's got a chronic postural problem to it, then you may be interested in our Tricky Spine package. And that gives you 9 appointments to take over 9 months. Obviously, you and your osteopath will work out the management of that, because you may find that you use most of those in a few months, and then maybe have a few left over to see how you go and leave your appointments spaced out a bit longer. So you have a management plan basically with a package. Now, these packages used to get £30 off. Now we have put our prices up this year, and our packages are still at our older price. So they used to be £30. They are now, you get £48 off, which is a major saving. We also have a limb package, so bad shoulders, arthritic knees, tendon issues, all those sort of things that are, tendons are notoriously tricky to sort out, take longer to heal. So we have 7 treatments over 7 months. Now, you used to normally save £20 off this package, and again the prices have gone up, so now you can save £34 off this package. So they're certainly worth considering. And then we have our maintenance package. Now, this is 12 appointments that you can take over 12 months. And again, you'll work out with your osteopath when you need those appointments. So you may find that you actually have a tricky spine problem, but you use a maintenance package and you have 12 appointments, and you might use them over 3 months. It's for you and your osteopath to work out what you want to do with them. But the maintenance ones are amazing value. So they used to be, you pay for 12 appointments, but you only pay for 11. So you got a treatment free, basically. And obviously we have slightly different pricing pricing points for different osteopaths. So our associate osteopath, our senior osteopaths, and myself, we have different prices for. So now so if you saw me with a maintenance package, you would get £79 off that package, and my follow-up prices are £57. So it's a big saving. So you get £79 off the value of 12 appointments, basically. So it's worth considering. If you're in it for the long haul, then think about one of these packages. We also have, just to talk about your osteopath, We obviously have lots of osteopaths that work at the practice. We all have different specialities. We all treat slightly differently. So if you find that you are not changing, then it's maybe worth having a chat with our receptionist, and or sending me an email and saying, well, I'm not too sure about what's going on. And I can then advise you to which osteopath to see. So my email address is rianne@notjustbacks.com. Or generally people just have a chat with the receptionist and they say, actually, yeah, you should see, because they should see so-and-so, because they know a lot about the different osteopaths that are in the practice. Because obviously we work really closely with them and teach them about osteopathy and how people react and things like that. So it's always worth having a chat with the receptionist if you're unsure about anything. And as I say, our osteopaths have different ways of treating. We all came from different schools as well, and so and some people just respond better in a different way. So there's the structural way, the cranial way, and obviously some people use a lot of dry needling as well. Some are just purely structural, some are purely cranial, and like myself, I use a real mixed bag of treatment modalities. So so if somebody really hates being clicked, then we don't know how we can do stretching and massage and the cranial work, because the cranial work, even though it feels like nothing's being done, works at a much deeper level and works on your fascial system, which is like the second skin beneath us. And that the cranial way is really gentle. So if you're really reactive to being touched, or have had a whiplash, or any injuries, any long-term injuries, so you might have had quite a bad car crash many years ago, then actually, yeah, you know, a little bit of rubbing and sort of structural work is great, but you may well need the underlying unwinding as well. So yeah, so it's, everybody works slightly differently, and it's finding somebody that you can work with and you feel comfortable with, and that you trust what they're saying and doing. And this is the thing. It's like, it's getting that trust that obviously we know what we're talking about and you're happy with what we're doing with you. So that is day 10 to 14. And I will see you again soon, and we'll be discussing a little bit more about exercise next time. So there might be a bit of a gap till I see you again. But yeah, my email, rianne@notjustbacks, if you want to send me an email directly. Nice to see you. Bye-bye.